Linking on my brain. Okay. Linking on my brain. I got linking on my brain. Whoa.
Field of Vision, Chapter 167. Definition. Part of the external world seen by one eye, when it is fixed in one direction, is called field of vision or visual field of that eye. According to Traquair, the visual field is described as island of vision, surrounded by a sea of blindness. Binocular and monocular vision. Binocular vision. Binocular vision is the vision in which both the eyes are used together, so that a portion of external world is seen by the eyes together. In human and some animals, eyeballs are placed in front of the head. So, the visual fields of both the eyes overlap. Because of this, a portion of the external world is seen by both the eyes. Monocular vision. Monocular vision is the vision in which each eye is used separately. In some animals like dog, rabbit, and horse, the eyeballs are present at the sides of head. So, the visual fields of both eyes overlap to a very small extent. Because of this, different portion of the external world is seen by each eye. Divisions of visual field. Visual field of the human eye has an angle of 160 degrees in horizontal meridian and 135 degrees in vertical meridian. Visual field is divided into 4 parts, 1 temporal and nasal fields, 2 nasal field, 3 upper field, 4 lower field. Temporal and nasal fields. Visual field of each eye is divided into 2 unequal parts, namely outer or temporal field and the inner or nasal field, by a vertical line passing through the fixation point, Fig 167.1. The fixation point is the meeting point of visual axis with the object. Temporal part of visual field extends up to about 100 degrees, but the nasal part extends only up to 60 degrees, because it is restricted by nose. Upper and lower fields. Visual field of each eye is also divided into an upper field and a lower field by a horizontal line passing through the fixation point. Extent of the upper field is about 60 degrees, as it is restricted by upper eyelid and orbital margin. Extent of lower field is about 75 degrees. It is restricted by cheek. Thus, the visual field is restricted in all the sides, except in the temporal part. Corresponding retinal points. Corresponding retinal points are the area in retina of both eyes, on which the light rays from the object falls. It occurs in the binocular vision. The 2 images developed on retina of both eyes are fused into a single sensation. So, we see the objects with single image. The single sensation is because of the ocular muscles, which direct the axes of the eyes in such a way that the light rays from the object fall upon the corresponding points of both retinas. If the light rays do not fall on the corresponding retinal points, diplopia occurs. Diplopia. Diplopia means double vision. While looking at an object, if the eyeballs are directed in such a way that the light rays from the object do not fall upon the corresponding point on the retina of both eyes, a double vision occurs, i.e. one single object is seen as 2. Causes of diplopia. Permanent diplopia occurs during paralysis or weakness of ocular muscles. It occurs in myasthenia gravis also. In alcoholic intoxication, the imbalanced actions of ocular muscles produce temporary diplopia. Lesions in 3, 4, and 6 cranial nerves, oculomotor nucleus, red nucleus and cerebral peduncles also results in diplopia. Experimental diplopia. Diplopia can be produced experimentally, by the following methods: applying pressure from outer side of one eye and thus displacing the eye from its normal position by holding an object like pen or pencil vertically in front of face, at about 5 cm from the root of nose. It is not possible for the convergence of the eyeballs sufficiently. The light rays from the object do not fall on the corresponding retinal points and diplopia occurs. Blind spot. Blind spot is the small area of retina where visual receptors are absent. The optic disc in the retina does not have any visual receptors, and if the image of any object falls on the optic disc, the object cannot be seen. So this part of the retina is blind, hence the name blind spot. Normally, the darkness in the visual field due to the blind spot does not cause any inconvenience because the fixation of each eye is at different angles. Even when one eye is closed or blind, the person is not aware of blind spot. However, one can recognize blind spot by some experimental procedures. Visual field and retina. Light rays from different halves of each visual field do not fall on the same halves of the retina. Light rays from temporal part of visual field of an eye fall on the nasal half of retina of that eye. Similarly, the light rays from nasal part of visual field fall on the temporal half of retina of the same side. Mapping of visual field. The shape and extent of visual field is mapped out by means of an instrument called Goldman perimeter, and this technique is called perimetry. Visual field is also determined by Bjerrum, tangent, screen, or by confrontation test. Humphrey field analyzer is also used to map visual field, and it is more useful to test the central portion of visual fields.